I'm Kim. I'll be your nurse today. How are you?
I'm fine.
Alright, I'm gonna do a quick assessment on you, okay? I'm gonna get you to stand on the scale for me. Alright. I got your weight. You weigh how much?
200.
Alright, thank you. How tall are you?
5'4".
Alright, thank you, sir. Okay. Oh, I'm gonna get you to stand up one more time. We're gonna assess your vision on the Snellen chart right here in front of us, okay? We're 20 feet from this chart in front of you. I'm gonna get you to cover whichever eye you choose to cover first. All right, so we're gonna start with your right eye, and I'm gonna get you to read off the words that's on the chart for me. Okay, thank you. We're gonna cover up that eye, the opposite eye, which is your right eye. So we're gonna test your left eye now, okay? Thank you, sir. Okay, you can have a seat in the chair for me. Okay, and I'm just gonna look at your skin on your hands and your arms. And I'm gonna look at your nail beds here. I'm gonna look at your head. I'm also look at your ears here, okay? Take a look in your eyes. I don't have a pen light, but I would check your pupils. Okay. And then I will look into your ears if I had an otoscope. And I'll also check for tenderness in your ears. Alright, I'm gonna use my pen. And I want you to look at my pen and follow my pen, okay, without turning your head. Alright, I'm gonna test your hearing while you're sitting here for me. I'm gonna whisper some words and I want you to repeat after me, okay?
Red. Yellow. Green.
Thank you. Now I'm gonna test your right side here with the whisper test.
Red. Green. Purple.
Thank you. And I'm gonna check your radial pulse here in your left hand. Now I'm gonna take a look at your nose and then your lips, and then I'm gonna get you to open your mouth so I can look inside your mouth, okay? Okay, open wide for me and lick your tongue out. And I also would check the back of your throat if I was to have a tongue depressor, but I don't have one of those to check your gag reflex and all of that. But I would check your gag reflex if I had a tongue depressor. Alright, so I'm just gonna look at your neck and test to look at the symmetry of your neck. And look at your trachea. I'm gonna get you to turn from side to side for me. Okay, look down. And look up at the ceiling for me. Thank you. Any tenderness or pain with that?
No.
Okay. I'm gonna get you to slide the chair out for me. And I'm gonna check your thyroid gland, okay? Not too far. You can have a seat. Thank you. Okay. Relax for me. Alright. Thank you, sir. Right. Do you feel comfortable with your shirt on? Or taking your shirt off? I need to listen to your lungs.
don't matter.
Well, you can keep your shirt on, okay? I'm gonna get you to kind of scoot up in that chair. I need to look at the back of your chest, okay, and your shoulders. All right, I'm gonna just take a listen to you. Take some deep breath for me. Okay. Another deep breath. Deep breath. Okay, let me get you to slide back for me. Alright, so now I'm gonna see your lines from the front, okay? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Thank you. Everything sounds good. I'm gonna get you to perform some range of motion exercises for me. Get you to raise your arms up for me. Outward. Okay. And down. Okay. I'm gonna get you to raise them out to the front. Press against me as you press up. Okay. Down. Okay. I'm gonna get you to squeeze my hands. All right. Let me test your capillary refill. Okay. And check the brachial pulse. Alright, so let's take your jugular close. Now I want you to just breathe normal for me, okay? Let's take your heart sounds. Thank you, sir. Alright, now I'm gonna get you to lay down for me.
On my stomach or the back?
I'm gonna get you to lay on your back. Thank you. I'm gonna lift your shirt and I'm just gonna look at your stomach, okay? And now I'm gonna feel you for tenderness. And I'm gonna put pulse. Let's take your bowel sounds. Any pain, Mr. Thomas? I'm gonna palpate your liver, okay? Now I'm gonna feel for your femoral pulse. If that's fine, I'm just gonna lift your pants leg up a little, okay? Then I'm gonna feel your pop little pop little toe pulse. Relax your leg for me. And then your dorsal pedal toe pulse. Okay. And I will assess the scrotum. I will ask the patient to remove his underwears, and I will palpate the scrotum to see if there's any abnormalities there. And Mr. Thomas, I'm gonna get you to sit up and we're gonna do some muscle strength in your hips and your knees, okay?
Okay.
So we're just gonna start with your ankles. I'm gonna get you to move your ankles, and let's sit back in the chair so we can better get a view in the camera. Let's see. Right now I can be seen there. But since we can't get the view in the camera, I would ask the patient to move his ankles in a circular motion, which he's doing, but we can't get a view with the camera. And then, even with his hips, I would get him to stand up and move in a circular motion with his hips. Move side. I guess. Move your hips. I guess. Yeah. Okay. All right, Mr. Thomas. While you're standing up in front of the camera, I'm gonna get you to move on your right hand, your first finger to your nose. Now, out, and move that first finger to your nose. Take your hand out and move your first finger to your nose. Yes. And then I want you to move and then I want you to have a seat and use your heel and you to your shin. You know what your shin is? The front of your leg. Put your heel to your shin and rub it down. Yeah. Okay. Okay. And I will check his deep tendon reflexes with the tool, but I don't have that tool to check it. But I would tap it on his knee to check for that. But I don't have the tool to check his deep tendon reflexes. So, but if I had, I would test it to see. So, Mr. Thomas, I'm gonna get you to walk across the room for me. I'm gonna get you to start here, but we're gonna try to stay in camera view. I'm gonna get you to start here and walk across the room for me. Okay. All right, you can stop and come back. Okay. All right. And that's about all we can do here with what we have. That ends my assessment.